Just to kind of piggyback on, it's a good segue into this small trial, well, actually a larger trial now, the natural history study, which has been ongoing for how many years now? 8 years. So this was started through Vanderbilt and NYU, and now NYU is the primary site. And at Stanford, we recently, over the past year or so, have joined. And so, as Dr. Kaufman mentioned, to really understand a disease, especially a relatively rare disease like MSA, we need large numbers of patients to follow over time to try to understand, which markers are important that may indicate how the disease will progress, and which markers will influence what treatments are used and how we can follow the success of those treatments over time. So this study is a multi-center study. It's over 20 sites, actually internationally now, that are all pooling data and measuring the same data points over time, at least once a year for each patient. And so right now there are, as you can see, over there's 22 sites, I believe, here. We have sites in Asia and South America. A lot of the sites are in the Northeast U.S. And several European sites, and we have a few West Coast sites, and hopefully we can get more over here in the West Coast. So the patient enrollment here is dramatically increased, around 2015, with the recruitment of more of these sites, and the numbers are only growing. And so, and we're part of that, and happy to be part of that at Stanford. So Dr. Poston I think she went through yesterday the difference between what an observational study is, which is this study, and a treatment study, which our other panelists will discuss. This study it's strictly an observational study, so we're really trying to follow a disease over time to get a better sense of how the disease progresses, because another theme of, I think, this conference is how variable the disease is for each person, each individual. So we know that the progression of disease is many years, sometimes decades, and the time at which patients are diagnosed with significant symptoms, the disease has already progressed quite a bit. So one of the goals of studies like this is try to understand which features, which symptoms we can recognize early. And so when there are drugs available, we can treat patients with those symptoms, so it will halt the progression. So this just kind of goes through somewhat how we think of synucleinopathies. What we want to capture are patients eventually in what we call the premotor stage, before there are movement symptoms and gait symptoms and falls and passing out. We want to find patients that are either more mild, maybe just with sleep problems, or the autonomic symptoms, which those symptoms tend to occur first, and identify this population to use treatment, for trials. And then a secondary kind of input in this study is to capture patients that have already been diagnosed, especially MSA, to get a better sense of, in patients that have been diagnosed, which markers may indicate, a better or worse kind of progression in the disease. And so we can, kind of use that to compare to patients in this early stage for the purposes of drug trials. So a couple, features of main goals of this study. One is to document the clinical features and what we call biomarkers of patients with synucleinopathies, and understand how they evolve over time. So biomarkers can be anything from something in the blood that we can measure, to an imaging study, to something in the spinal fluid, or even something on a sleep study, something that we can follow year to year and see how that changes. So we went through this already. The premotor phase are patients that we diagnose with either only REM sleep behavior disorder, or only the orthostatic hypotension, and really nothing else. And then the other subgroup of patients in the study were including patients with Parkinson's, Lewy body dementia, as well as MSA. So really trying to capture the whole kind of gamut of synucleinopathies and try to understand how we can counsel a patient, how they might progress over time, and eventually, hopefully, be able to halt the progression. So just give you a kind of overview of what this study entails. So all of the visits they should be, what we call standard of care. So they should be visits that you're having anyway, and tests that, should be done anyway by your physicians. So they're mostly office visits, at least once a year, and if you can't come in, phone visits can be done. The aim of the study is to follow patients with, for at least 5 years with purely autonomic failure, and then also, again, to compare those patients to all of these other subgroups to see, what the similarities are. So again, we talked about this. So the NYU group's goal, which I think is very ambitious and admirable, is to capture every patient with MSA in the world. So they're getting there. Not quite there yet, but that's. I think Lucy can do it. I think she can do it. So what are the inclusion criteria? Well, one is if you have orthostatic hypotension, and this can be measured in the office by any of your doctors, and we talked about that this morning. Another is, of course, if you have a diagnosis of MSA, with or without the orthostatic hypotension. And another, which is not relevant to this group, is if patients with Parkinson's or Lewy body dementia. A fourth group, which is my particular interest, are patients that only have REM behavior disorder, because we know that these are the patients that are definitely going to develop the brain disorder later on, but they represent kind of the group at which you can intervene the earliest with treatments. And so if you did enroll with this study, what would that look like? Well, there's a bunch of questionnaires which will probably take about half an hour for you to fill out, and these can be given ahead of time before the visit. There's a clinical exam by one of the neurologists. We do smell testing because we know that smell is one of those things that can help distinguish the subtypes of these synuclein disorders. Smell is less affected in MSA. It's more affected in Parkinson's, so that's another potential biomarker that we can follow. We do a cognitive exam called the MOCA. We go through some red flags of MSA for every patient. The doctor will do that and go through your current treatments. One of the criteria to be enrolled is to have autonomic testing, so that has to be done pretty much at a select group of centers, which is why all of the centers that you saw on that map are basically autonomic centers, or at least have an autonomic lab. So to be enrolled in this study, you would have to undergo the autonomic testing that you kind of reviewed this morning, and that would consist of the tilt table test, the Valsalva breathing into the tube, and probably the sweat test. All non-invasive, and it usually takes about an hour and a half to do this. Another possible sample that will be collected would be blood. This isn't really kind of online, at least for our site yet, but in the future we could do some blood banking to store the blood for DNA analysis in the future. And then there was also an optional brain donation component of the study. This is all repeated once a year, and if you can't make it to the primary site, then someone can call you by phone, but ideally it would be you would enroll in this if you are able to travel to one of these participating sites, because that's really how we're going to get kind of the best information. And if you're interested, I would say have your any doctor refer you to our center or to one of the centers in the site. You can find a list of the centers on clinicaltrials.gov if you look up the study. But because the autonomic testing is required, you would have to physically come in first to have that testing, and then be enrolled in the study. You can always contact us. Any questions, be happy to answer them. So, all right. Thank you very much.